Hey everyone, welcome to Explain Medicine. In this video we're going to discuss frontotemporal dementia, also known as FTD, and how it affects Hollywood actor Bruce Willis. FTD is a rare and devastating form of dementia that affects the frontal and temporal lobes of the brain, causing changes in behavior, personality, and language. In this video we'll take a closer look at what FTD is, how it is diagnosed, the symptoms, and the prognosis. In the spring of 2022, Bruce Willis was diagnosed with aphasia. More recently, with the progression of the disease, it was announced that Bruce Willis was struggling with frontotemporal dementia. This news came as a shock for many of his fans, as Willis is known for his tough guy roles in action movies such as Die Hard and Armageddon. Despite his earlier diagnosis of aphasia, Willis continued to work in the entertainment industry, appearing in movies and TV shows, until more recently he retired from acting due to further progression of the disease. Frontotemporal dementia is a rare type of dementia that can affect people as young as 40 years old. FTD is caused by damage to the frontal and temporal lobes of the brain, which are responsible for decision-making, behavior, and language. Unlike other forms of dementia, such as Alzheimer's disease, memory loss is not typically an early symptom of FTD. The early symptoms of FTD can be subtle and easily mistaken for other conditions, such as depression or anxiety. Symptoms can include changes in behavior, personality, and language, including difficulty expressing oneself or using socially inappropriate words. Patients with FTD may also experience a lack of empathy, decreased motivation, and difficulty with social interactions. As the disease progresses, symptoms become more severe, and patients may experience difficulty with everyday tasks, such as getting dressed, preparing meals, and driving. They may also develop movement disorders, such as muscle stiffness, tremors, and difficulty with coordination. The diagnosis of FTD is challenging and requires a comprehensive evaluation by medical professionals. A complete medical history, physical exam, and cognitive testing are essential for an accurate diagnosis. Brain imaging, such as MRI or CT scans, may also be used to detect changes in the brain that are characteristic of FTD. There are several different types of FTD, including behavioral variant FTD, primary progressive aphasia, and cortical basal degeneration. Each type has its own unique set of symptoms and characteristics, making an accurate diagnosis even more challenging. Unfortunately, there is currently no cure for FTD, and treatments focus on managing symptoms and improving the patient's quality of life. In some cases, medications may be prescribed to manage behavioral symptoms or mood changes. Speech and occupational therapy may also be helpful in managing language and motor difficulties. The prognosis for FTD varies depending on the age of onset, the specific type of FTD, and the severity of symptoms. On average, patients with FTD survive between 6 to 8 years after the onset of symptoms. However, some patients may survive up to 20 years with proper management and care. Living with FTD can be challenging, not only for the patient, but also for their loved ones. Caregivers must learn how to manage the patient's behavior and language changes while maintaining their safety and well-being. Many organizations, such as the Association for Frontotemporal Dementia, offer resources and support for caregivers and patients. In conclusion, frontotemporal dementia is a devastating form of dementia that affects decision-making, behavior, and language. The diagnosis of FTD is challenging, and there is currently no cure for this disease. However, with proper management and care, patients with FTD can live a meaningful and fulfilling life. We hope that this video helped you better understand FTD. Please don't forget to hit the like and subscribe button below. Thanks for watching.